Good afternoon, everyone. Welcome and thank you for joining us today for the role of dietary supplements in maintaining cognitive health and mental hygiene with Dr. Jim Greenblatt. This webinar is brought to you today by the Council for Responsible Nutrition, and they are the leading trade association of the dietary supplement and functional food industry. Dr. Jim Greenblatt currently serves as the Chief Medical Officer at Walden Behavioral Care in Waltham, Massachusetts, and serves as an Assistant Clinical Professor of Psychiatry at Tufts University School of Medicine. Since 1990, he's devoted his career to educating his colleagues, clinicians, and patients of how integrative medicine can have profound effects on mental wellness and how to employ balanced integrative strategies in the treatment of mental illness. We are very grateful to have him here speaking on this topic today. Dr. Greenblatt is going to present for about 45 minutes, and we will leave some time for a brief question and answer session at the end. You may submit questions to Dr. Greenblatt throughout the presentation on your GoToWebinar control panel. A PDF of his slides will be made available as well as a link to the webinar recording in a follow-up email. So at this time, I would like to welcome Dr. Jim Greenblatt.
Excuse me. Great. Thank you very much. And looking forward to presenting for you this afternoon. When we talk about cognitive health and mental hygiene and any aspect of mental illness, I think that it's fair to say, as a medical profession, as allied health professionals, that we have failed in many, many ways. The treatment of cognitive decline, the treatment of mental illness, it's certainly all over the news, but in the trenches, it's quite clear that we have struggled. And what I want to share with you is some ways that we can improve the treatment of mental illness and cognitive health. And it's a word we've all been familiar with, but just to rephrase it, what I hope to speak with you about this afternoon is integrative medicine for mental health. And this is two quotes by Ralph Snyderman talking about the sick care system that we have, a symptom-based model, and looking for prevention, predictive, and personalized treatment. And then the recent opening of the P4 Institute, where we added, based on the work of Dr. Hood, predictive, personalized, preventative, and participatory. These are really, really important concepts that we need to figure out how we can integrate into our healthcare system. The problem is pretty obvious to all of us with family members or friends who've struggled with emotional or psychiatric issues. But just to really highlight that depression now is considered the second highest rate of disability due to depression. It's the most serious and costly health problem in the world today. Suicide is both dramatically increasing due to all ages. On the bottom, you can see that every day 25 vets take their lives, and by 2020, suicide will increase to one suicide every 20 seconds throughout the world. It is an increasing crisis, and we want to reframe that in terms of brain health. And how do we do that? One, we kind of understand what happened with our model, and the model being that we don't have a model, I guess might be the better way of framing it. But in the rest of medicine, if we have a problem, let's say someone presents with a cough or a headache, those are the symptoms, and we're going to measure the physiology. We're going to measure something to identify what might be causing the cough. So we might, look down someone's throat. We might do a chest X-ray. We might do a blood test. We might do a CAT scan, MRI, or a biopsy. But either way, we're going to measure something. And based on what we find, the difference between viral pneumonia, bacterial pneumonia, or lung cancer, that the treatment is going to be different. And then after we do that treatment, we're going to measure it again. And what is our model in psychiatry? we just have this list of symptoms. And then every prescription medication in psychiatry is just a anti-symptom treatment. We have classes of medications called antidepressants. They work in many different ways, but irregardless to what might be causing the symptoms, we give the same treatment. And it's gotten us into lots of trouble because we have no objective findings, way of looking for what might be contributing. If someone walks into the office, we're essentially doing our crystal ball, trying to put together what the symptoms might mean if we have a diagnosis, but everything is based on the symptoms with no concept of what's causing it and or what might be contributing to it. So we have to do better. But when you have a symptomatic-based program, the only thing you can do is this anti-symptom medication, and here's this polypharmacy highway that our mental health community has been down, for over 30 years now, and it's not working. We have high relapse rates. We talked about the suicide rates, and the most dramatic symptoms is that 66%, two-thirds, have residual symptoms. So we do a study for an antidepressant, and we're measuring one thing. Mood might be better, but there might be no sex drive, poor sleep, poor appetite, a whole host of other problems. And these are dramatic studies that we've known now for 10 or 15 years. More importantly, many of the medications that we thought were helpful as we relooked at those studies, a recent paper looking at the Paxil study for the approval for the treatment of adolescent depression was reanalyzed, and it was demonstrated that actually it was not beneficial and harmful. The polypharmacy highway has not been effective, and we can do better. In the first depression book that we wrote, we tried to come up with a mnemonic to help individuals kind of get that big picture. What might be contributing to the depression? I always use the analogy of 10 patients, 30-year-old males walked into the office with the same symptoms, irritability, sadness, poor sleep, ruminations about suicide, difficulty concentrating. We might call that depression, but there could be 10 different causes. So the zebra approach is just a mnemonic that kind of helps remember the kinds of things we need to look for. And we chose the zebra for really the most important part is the fact that every zebra has unique stripe patterns. And the whole concept of an integrative approach to the treatment of depression is making sure we're always appreciating the biochemical individuality, if you will, the individual differences that we all bring to our physiology, our biochemistry, mainly through genetics. So the zebra approach for the treatment of depression is just a kind of reminder. We're looking at stress, sleep, refined sugar, hormones, allergies, celiac disease, minerals, fatty acids, the vitamins, the GI tract, and amino acids. And some of these, obviously, we're not going to be able to talk about today, but a few of them I will try to talk about today. I want to talk about what's certainly getting a lot of press now is our concern around obesity and the obesity epidemic, and our obsession with this no-fat, skinny, low-fat, what else we have? Fat-free, light for the past 30 years. It has not done much for our obesity epidemic, and what I'll share with you briefly is that our restriction of fat intake has probably affected mental health and brain health more profoundly than heart health. The brain is 60% fat, the dry weight of the brain, and 30% of the fatty acid pool cannot be made and needs to be obtained by the diet. Low-fat diets don't work. I eat fish every day. My butt still drags on the ground. There's lots of both humor and misconception about where fat fits in the diet. Over the past, I think, few years, the integrative nutrition community has now kind of blessed healthy monosaturated fats in the coconut oil and the avocados and the fish oil. But there's very, very clear research looking at where particularly omega-3s and some of the omega-6 fit into brain health. Every aspect of neurotransmission, the way the brain communicates with neurons, involves adequate functioning of these omega-3 fatty acids. They influence the flexibility of the membrane, which holds all the receptors for all the neurotransmitters. Omega-3 research and depression and mental health really is in the thousands of references. Some of the most dramatic have to do with the omega-3 and suicide. We talked about increased suicide in our veterans. This was one study where they had blood tests of 800 servicemen who committed suicide for the 6-year period. And the personnel with the medical records having the lowest levels of the omega-3 DHA were 62% more likely to have been suicide victims versus those with the highest levels. We have other references, actually quite a few from the US and China, in particular showing low levels of omega-3s associated with higher risk for suicide. This study really points to the kind of integrative concept that is real important to my work, that we don't throw away medications that can be helpful, but augmentation strategies with nutrition is important. So here was 42 patients where a double-blind placebo-controlled trial adding the EPA and DHA to the antidepressant group, and a high proportion of the patients received full remission in the omega-3 plus the antidepressant group, 44% versus 18%. So one of the misconceptions that we hear about all the time and patients bring to us is that, there's either camp, I can never take medications, medicines are evil, it's toxic psychiatry, or just taking vitamins. So it's not either or. The integrative approach is by far the most helpful. This is one of the more dramatic studies I've read on where omega-3s fit in terms of brain function. This is a study that was done a number of years ago, but has recently been followed up, and a couple supporting studies demonstrating the same concept you see here. It was 81 adolescents with what was called subthreshold psychosis. So histories of psychotic thinking, and they were given 1.2 grams, a relatively small amount of omega-3 fatty acids, or placebo. Again, they were only giving it for 12 weeks, followed for 40 weeks, and the results were dramatic. Those that received the fish oil, 5% developed psychosis versus 28%, statistically significant difference. Since this was done in 2010, this group and other groups have demonstrated a strong correlation between the intake of polyunsaturated fatty acids as well as levels of polyunsaturated fatty acids associated with brain function, and particularly thought disorders and cognitive decline. And then the last study that I just want to share with you is oftentimes we start reading about a nutrient or a supplement that might be helpful, and supplement companies come up with a new name, and people are just taking supplements. I call it, label therapy, just based on a pill rather than an individual. And this helps us begin to understand, where omega-3s might be helpful in the treatment of major depressive. This was a very well done study, and here they looked at inflammation. So using a very, very simple blood test called C-reactive protein is a general measure of inflammation, and this study showed that measures of inflammation predicted a better response to the omega-3 fatty acids. We know the omega-3 fatty acids are anti-inflammatory. We know inflammation is one of the models that could contribute to depression. And here's a nice way of looking at how to use supplements. We do a lot of our work based on testing, looking at levels of fatty acids, looking at levels of vitamin minerals. That's not practical for everyone. So a general measure of inflammation is a predictor of who benefits from omega-3 in depression. Certainly part of the kind of fat phobia is mainly been focused around cholesterol, this evil molecule that we've completely really misunderstood. And my concern is how we misunderstood in terms of brain function. So brain being dry weight of the brain being 60% fat, a lot of that fat is cholesterol. The brain is a cholesterol-rich organ. In terms of human physiology, it's involved as the precursor to every steroid hormone, and we're talking over 200 hormones from testosterone to estrogen, etc. Cholesterol is critical for stabilizing, activating receptors in the brain, the serotonin and oxytocin in particular. Our digestion of all fat-soluble nutrients depend on bile salts from cholesterol, and then clearly vitamin D we'll talk a little bit about later. But just in this one slide, you can see the critical importance of cholesterol in terms of human physiology, brain function, and healthy brain health. And the research makes it even more frightening. We have academic, well-done research looking at low cholesterol, and here we're mainly talking about low cholesterol as a under 140 total cholesterol. And this is research that besides cancer, violence, stroke, we have increased anxiety and depression, and there's studies looking at school suspensions, even drug addiction. One of the really fascinating parts of our work has been looking at a subset of pretty aggressive, sometimes violent young adults who are eating junk food, eating high-fat diets, and have total cholesterols between 90 and 120. These individuals are more treatment refractory to medications. These individuals have very, very poor impulse control and high rates of depression and suicide. Again, there are double-blind studies looking at school suspensions and actually drug addiction, recovery from cocaine, rehab. Those individuals with the lowest cholesterol had the highest rate of relapse. So the kind of summary of the research is, what's good for the heart is good for the brain. So the ratios of HDL and LDL are still important, but there is this, I believe, genetic difference in some individuals with total low cholesterol, under 120, is significantly associated with mental illness. We treat it by, one, dietary recommendations, including eggs, and sometimes we even need to include cholesterol supplements. We looked at that study. It's not a quick fix. So many of our patients, so many of us are looking for that pill that's going to, help us right away. If you read the infomercials or see the infomercials of the krill oil or the red pill, you feel like you're going to feel better in a week or a month. But it's quite clear that, we say it takes 3 months to change your oil. So to get the healthy fats into the neurons and the membranes, this one study demonstrated 10 weeks for cerebral membranes to incorporate the unsaturated fatty acids. So this is just a quote that really is powerful. I think it gives us the image of how important fat is to the brain: cholesterol, polyunsaturated fats, monosaturated fats. And by altering these fats, we've altered the basic building blocks of the brain in like unstable buildings that come apart in an earthquake and storm. Poorly structured human brains are failing to cope with the mounting stress of modern life. We have to be kind of overwhelmed with the increased incidence of neurodegenerative diseases, neurological diseases, dementia, Alzheimer's, and mental illness in both the young children and elderly, and diet certainly has been shown to have a huge role. In a short talk like this, it's hard to go over all the nutrients and all the variables that are critical to looking at mental health and cognitive health. So I use celiac disease as an example, and I'm sure you're all aware of that not everyone that presents with celiac disease, gluten sensitivities, have GI problems. So oftentimes there are non-gastrointestinal manifestations of celiac disease, and fatigue and depression are often the only presenting sign of celiac disease. So celiac is an autoimmune disorder where we destroy the intestinal villi so we can't absorb nutrients. And there are lots of nutrients that we can't absorb. The essential fatty acids I talked about, amino acids, and then iron, folic acid, B vitamins, and zinc. This one study that I put here, that even patients presenting who've been on a gluten-free diet showed malabsorption persisted even if the diet was 100% gluten-free. So one of the patients that I had seen a couple of years ago was a gentleman who, a college student, whose parents brought him in when he was home, and at college the doctors put him on amphetamines because he all of a sudden developed ADD, which he didn't have doing very well in high school, and then got so stimulated on the amphetamines that they put him on Xanax. So he was taking Xanax all afternoon and the evening, and he kept increasing the amphetamine dose and then increasing the Xanax dose. And when I saw him, we just did a nutritional screen, and this was a relatively healthy-looking young man with no dietary restrictions, not vegetarian, and he was deficient in iron, B12, folate, just based on our initial screen. And again, based on his dietary intake, it made no sense, and a celiac screen was positive, and biopsy was positive for celiac disease. So again, I use the GI kind of malabsorption focus of celiac disease to reflect how powerful the malabsorption of these nutrients can be for brain function. All these nutrients are critical for healthy brain function and for healthy neurotransmitter synthesis. All of our neurotransmitters are based on a kind of amino acid precursors. These amino acid precursors require vitamin and mineral cofactors to make the dopamine, serotonin, norepinephrine. Celiac disease is just one mechanism where there's malabsorption of these cofactors, and we have significant cognitive symptoms. Okay, so one of the common deficiencies in celiac, and one of the common deficiencies in some of the work that I do with eating disorders, anorexia in particular, is the profound effect zinc has throughout the GI tract and the brain. So this is just a compilation of 3 studies looking at zinc and depression, and there's high correlation. We have serum zinc levels inversely correlated to depression. A study adding zinc to a multivitamin with a reduction in depression. and then 25 milligrams of zinc as a supplement by itself, decreasing depression scores. Here, it was interesting in that these were patients who were not responding to traditional antidepressants. So we had a 12-week study, 60 patients. Those that did not respond to the antidepressant, zinc supplementation significantly reduced scores. And again, just as we talked about with the essential fatty acids, zinc is an incredibly wonderful augmentation strategy that can be used with medications. And this is a recent study. It was a meta-analysis looking at 17 studies, 1,600 individuals, and again, the same findings, zinc levels, lower zinc levels associated with depressed mood. So I want to just take a minute to share how important zinc is in digestion, absorption, and brain function. So we talk a lot in integrated medicine about dietary intake is not as critical as your ability to absorb and digest nutrients. The first part of digestion of protein is hydrochloric acid, which is made in the stomach, and zinc is required for the synthesis of the hydrochloric acid in the stomach. So it's a zinc-dependent enzyme that drives that reaction. So we need zinc to help digest protein. And then what is even more dramatic is zinc is a component, a co-factor in all the other digestive enzymes from our pancreas to break down protein, carbohydrates, and fat. So without adequate zinc in our diet, we begin to get symptoms of indigestion. Often patients describe the bloating and the not feeling hungry. And the not feeling hungry is related to the effect that our taste buds, gustin, is a zinc-dependent enzyme. So zinc deficiency is commonly found in individuals who don't have a sense of taste. We see that in the elderly. We see it commonly in our geriatric patients, our anorexic patients. So lack of taste is a common symptom of zinc deficiency. So here's kind of our summary of how significant zinc can be. We talked about the bloating and discomfort with lack of enzymes and acid, but we also need zinc to make melatonin from serotonin. We talked about taste. I talked about the essential fatty acids, but there's a zinc-dependent enzyme that's critical for the metabolism of the essential fatty acids. We have meat avoidance. People who are zinc deficient have this distaste for meat. We see it in vegetarians, and we see it in our anorexic patients, and then the depression and the attention difficulties. There's lots of work with zinc and ADHD, and zinc is often recommended with our ADHD patients and used, again, with stimulants. I think zinc is particularly deficient, one, due to dietary concerns. A vegetarian diet does not have adequate sources of zinc, particularly our adolescents who, being a vegetarian means just eating pasta and maybe a potato chip. And also the toxins, the numerous environmental toxins bind zinc and make it unavailable in the diet. So I don't mean to pick on vegetarians today, but certainly zinc and B12 are some of the most common deficiencies we see in vegetarians, but we also see in depression, anxiety, and mood concerns. B12 deficiency, I believe, is the most tragic medical misdiagnosis or misinformation that I've seen in my career of 26 years. It is a very simple to treat, but very disabling illness that is misdiagnosed and poorly treated. This is a wonderful book by Sally Pochlock and her husband on B12. There's lots of information on the internet. I just wish our physicians had this information. What does the information look like? Basically, the lab values that we look at for B12, you see in the first sentence that 200 to 1100 is the normal range. And that's kind of absurd in itself to have such a broad range of normal. In other countries, it's over 500. And in my clinical experience, no one feels well with the B12 level under 500. This is just a quote from Quest Laboratories, where they added that disclaimer on the bottom. You see, patients between 2 and 400 may experience neuropsychiatric symptoms. Well, if you don't get your lab slip done from Quest, if you go to your PCP and you have a B12 level of 232, they'll tell you it's fine, it's normal, and I will guarantee you that person does not feel well or has one of the symptoms listed in this slide. And with B12 supplementation, there's often dramatic changes in these symptoms. The most important thing I can share with you that we've talked a lot about is this concept of biochemical individuality. And we see it with every nutrient, with every deficiency, that a deficiency of B12, someone could present with just depression, someone might present with fatigue, but there's a literature and we have cases where individuals present with a paranoia, physical symptoms of tremors, looks like multiple sclerosis, clumsiness, both neurological and psychological symptoms are common, and you cannot predict. So B12 deficiency needs to be treated, and we need to be aware of it when we have any of the above psychological or physical symptoms. Very few studies in the literature now, because B12 is cheap and expensive. It's not a pharmaceutical. This is just one study for depression, 2 men who failed to respond to 3 trials, vegetarians with low B12 levels with supplementation improvement in 3 to 4 weeks. In my practice over 26 years, I have hundreds and hundreds of cases that look like this, and I can share with you some of the most gratifying work that we do because it's a simple intervention that people see results. It contributes to treatment refractory with medications, and most concerning, I believe, that it interferes with cognitive function, and if it's not missed, it's a precursor to cognitive decline and dementia, and then becomes irreversible. So I want to make sure we leave time for questions, but I did want to share a little bit with you about another nutrient that's been a real important part of the work that I do, and that's lithium. This was an editorial in the New York Times by a woman with bipolar illness. She's now a writer. I don't believe in God, but I believe in lithium. And this is a woman who was on high doses of lithium carbonate with a dramatic improvement in her mental health when she took it, but then she developed kidney disease. So we rarely use lithium at therapeutic dosages because of the side effects to the kidney and the liver. The dosage makes it either a poison or a remedy. And the work that I've been doing over the last few years is looking at nutritional lithium, low-dose lithium that we might find in the water supply that has profound effects on cognitive and brain health. To just give you a sample of how powerful low-dose lithium is, these are studies done around the world just looking at the tap water, drinking water in 27 counties in Texas, Japan, and Austria. And all the studies demonstrated that the suicide rate and suicide mortality rate were inversely associated with lithium, meaning if you lived in a community with very low lithium in the drinking water, which is our major source of lithium, that you had higher incidence of both depression and suicide. And this has been repeated recently in Texas, and the literature is quite strong. So we know these low dosage has effect on brain health. And these are some of the cases hundreds of cases that we've seen over the years. I'm going to start with Patricia, who was a therapist. She had a substance abuse problem, drinking, family history of substance abuse, and diagnosed with depression. She had poor response to antidepressants, but has done well over the years. She's been sober, and she came to see me due to side effects to her antidepressants. But we put her on lithium. This was 5 milligrams of lithium orotate. And she came back in a follow-up a month later, and she just started crying in the office because one of the things that she realized just by starting the lithium without any other interventions is that how kind of nasty and irritable she had been with her daughter and her husband. Just didn't realize it until she was on the lithium, which calmed that symptom of irritability. And she realized that it was such a powerful trait. Nutritional lithium is something we use for individuals with a family history of depression or bipolar illness, family history of substance abuse. But the most common symptom is that kind of irritability and rage. There's one gentleman that presented who had road rage, and on this low-dose lithium completely resolved. The more interesting work in lithium is actually in the prevention of Alzheimer's. There's now research looking at low-dose lithium for dementia, Alzheimer's, and this was a study that kind of got people thinking about it, that bipolar patients that took lithium had a much lower rate of Alzheimer's versus patients that didn't take lithium. There's a wonderful literature on all the neurochemistry and the enzymes and the neurotransmitters that contribute to cognitive decline in Alzheimer's, and the lithium, the scientific literature is quite profound in demonstrating how lithium can kind of modulate many of these cascades. And it's something that we've been writing about over the past year. It's a good website. We just started lowdoselithium.org, and we hope to get this book finished over the next couple of months. So nutritional lithium, not prescription lithium, has profound implications for brain health and cognitive decline. There was just an article in the Townsend newsletter that we published on low-dose lithium that gives you a good overview. So when we talk about integrative medicine, it is not just nutrition and supplements. We're talking about our lifestyle, diet, and kind of mind-body approaches to health. Spirituality is one aspect of mental health care that's been ignored. I think more in the substance abuse literature we've been able to address faith and spirituality, but the research in the depression and mental health is quite clear. Those that report a stronger faith have one, lower incidence of depression. They improve quicker on the antidepressants, less side effects on the antidepressants. Really kind of dramatic studies on where spirituality fits in. So I've kind of given this very quick overview of nutrition and mental health. Just a few kind of slides I use to demonstrate how profound this effect is. This was a study of prisoners done in London, 231 prisoners. It was double-blind, placebo-controlled trial. So they were eating the same prison diet, and they were just given 2 supplements, a multivitamin that was over the counter in London, as well as essential fatty acid supplement. These individuals, after 4 months, a dramatic difference in behavior, 26.3% fewer offenses, and 35% reduction in violent offenses. These are really dramatic. This study was repeated. And think of the public health implications. This was over-the-counter multivitamin and essential fatty acids having such a profound effect on behavior. Again, double-blind, placebo-controlled trial. So I hope we look at integrative medicine and particularly nutrition not as alternative medicine. Getting a B12 level should just be good medicine. And these are the kinds of nutritional and vitamin factors that should be, built into the assessment of all of our patients struggling with kind of emotional or mental health needs. Again, those 10 individuals that walk in the office with depression, if you don't look for a B12 level and you just treat because you think they're might have a vitamin D deficiency, you're going to miss something. So our integrative approach includes both biochemistry, genetics, the social and psychological environment, and probably one of the important things we forget to ask is trying to understand what the patient's experience and beliefs about his or her illness is will give us a better kind of template as to how to help. So my life gets better when Lancet Psychiatry starts publishing articles looking at nutritional medicine as mainstream in psychiatry, and a major psychological journal begins to look at nutritional interventions and microbial understandings for mental health as well. So I'll end by kind of sharing with you the big picture, and the work that we do is looking at integrative psychiatry, looking at multiple areas in the physiology. If we can begin to find the cause, we might be able to use words like cure. Cure is not something that is discussed much in the mental health community because we just use symptomatic Band-Aids, but we can find the cause. If celiac disease is contributing to B12 and zinc deficiency, we go on a gluten-free diet, supplement, we can cure the depression. And the model also kind of provides a model for prevention. If we look at inflammation, if we look at vegetarian diets and working on supplementing nutrients like B12 and zinc, we can prevent significant disability from mental health. These are two books. The Integrative Therapies one should be on December. This has over 3,000 references, academic references, just taking depression and providing a very, very academic look at these integrative models. And then the Breakthrough Depression Solution was kind of our zebra approach, helping simplify. So why don't I stop here so we have time for questions. And these are some of the web pages if you need to reach me.
Okay, great. Thank you, Dr. Greenblatt. So I do have one question here. It says, Dr. Greenblatt, have you discussed the importance of omega-3s and DHA? You have discussed the importance of omega-3s and DHA for proper brain function. Could you please touch on the role of omega-6 fatty acids and how they differ?
Oh, great question, because I think it was the omega-3 research starting actually in 1999 with high-dose omega-3 and bipolar disorder. They were giving 9 grams to patients, that the psychiatry community, again, in our desperate attempt to help our patients, much like we do with meds, just started giving everyone high-dose omega-3 supplements. And not everyone needs mega doses of fish oil. And what we started seeing is an imbalance in the omega-6s, and particularly women coming in with very low levels of GLA and with symptoms of depression. So I'm not a huge fan of these 9 grams of omega-3 supplements. For many individuals, particularly with ADHD and women with depression, without testing, I recommend a balanced EFA formula that has GLA and EPA and DHA. If we do the omega testing, then we kind of predict supplements based on that. The punchline is many individuals, even though the buzzword out in the community and even among our very well-respected integrative docs, is that we all get too much omega-6 and we need to just take omega-3. Well, looking at testing thousands of individuals for 25 years, we often see low levels of omega-6. So we need to be cautious and careful.
Great, thank you. And just to remind the audience, you may submit questions to Dr. Greenblatt on your control panel at this time. Dr. Greenblatt, the next one is, do you have recommendations for how to combat issues of malabsorption in patients with celiacs?
Well, I think the most important thing is the gluten-free diet, but I think what some of the studies have shown, particularly some of the pediatric studies, and I tried to mention earlier, even on a gluten-free diet, we see deficiencies, particularly zinc and the amino acids, for a long time. One study demonstrated up to a year on a gluten-free diet, there was still malabsorption issues. So I'm pretty aggressive about testing and nutritional support, and with digestive enzymes to help absorb the nutrients for extensive periods for somebody, particularly with symptoms of depression or fatigue. So adequate zinc, B12, and amino acid supplementation, even if someone's on a gluten-free diet.
Great. Thank you. That's all we do have one more. Here we have Amy is asking, are low levels of glutathione an issue in mental health? And if so, how should we best supplement?
You said potassium?
Glutathione. I will send this question over to you.
Okay, let's see if I... Oh, glutathione.
Thank you.
No problem. A good question. It's hard to detect levels of glutathione, but is the most abundant antioxidant, particularly in the brain. One of the effective treatments that we have across a wide range of neuropsychiatric illnesses is the use of a supplement called NAC, N-acetylcysteine, which helps support the synthesis of glutathione. So NAC has been shown to helpful in bipolar depression, the hair pulling disorder, trichotillomania, as well as obsessive compulsive disorder. So I do believe adequate supplies of glutathione is important, as it's hard to supplement, so we use N-acetylcysteine.
Excellent. Well, that concludes our session for this afternoon on the role of dietary supplements in maintaining cognitive health. I'd like to thank you, Dr. Greenblatt, for your time today speaking on this topic. And I'd like to remind the attendees that this will be available for replay. We will send a link as well as the slides in a follow-up email posted to YouTube. Thank you all for joining us.
Great. Thanks very much.